Understanding hysterectomy, a necessary procedure. A hysterectomy is a surgery to remove a woman's uterus. The uterus is where a baby grows during pregnancy. After a hysterectomy, a woman can no longer get pregnant. This is a big decision, and it's important to understand all of your options. There are many reasons why a woman might need a hysterectomy. Some women have heavy periods that cause them pain or anemia. Others have fibroids, which are non-cancerous growths in the uterus. In some cases, cancer may be the reason for a hysterectomy. Hysterectomy is a common surgery, but it's still major surgery. It's important to talk to your doctor about the risks and benefits of the procedure. You should also ask about the recovery process and what to expect after surgery. If you're considering a hysterectomy, it's important to be informed. This guide will provide you with the information you need to make the best decision for your health. We'll discuss the reasons for hysterectomy, the different types of procedures, and what to expect during and after surgery. Hysterectomies are performed for a variety of reasons, each addressing specific health concerns. One common reason is uterine fibroids, non-cancerous growths in the uterus that can cause pain, heavy bleeding, and bladder problems. Endometriosis, a condition where uterine-like tissue grows outside the uterus, can also lead to hysterectomy due to severe pain and infertility. Another reason is uterine prolapse, which occurs when the uterus drops into the vagina due to weakened pelvic muscles. This can cause discomfort, pressure, and urinary incontinence. Abnormal uterine bleeding, characterized by heavy or irregular periods, can also necessitate a hysterectomy if other treatments prove ineffective. In some cases, hysterectomy becomes necessary to treat gynecologic cancers, such as uterine, cervical, or ovarian cancer. This decision is made to remove the cancerous tissue and prevent its spread. Adenomyosis, a condition where the uterine lining grows into the uterine wall, can also lead to hysterectomy due to heavy bleeding and pain. It's important to remember that hysterectomy is typically considered a last resort after other treatment options have been explored. Your doctor will thoroughly evaluate your condition and discuss all available options before recommending a hysterectomy. There are different types of hysterectomy surgeries, each tailored to the patient's needs. A total hysterectomy removes the entire uterus, including the cervix. A subtotal hysterectomy removes only the upper part of the uterus. A radical hysterectomy removes the uterus, cervix, surrounding tissues, and part of the vagina. Advances in techniques offer less invasive options like laparoscopic and robotic-assisted hysterectomy. Your doctor will discuss the best type for you, considering benefits and risks. Preparing for a hysterectomy involves several essential steps to ensure a smooth surgical experience and recovery. Your doctor will provide specific instructions based on your health status and the type of hysterectomy planned. You'll undergo a comprehensive medical evaluation, including a physical exam, blood tests, and possibly imaging scans. Inform your doctor about all medications, supplements, and allergies you have. You may need to adjust or stop certain medications before surgery. Quitting smoking is crucial, as it can significantly impair healing and increase the risk of complications. Maintain a healthy diet and exercise routine to optimize your overall health and prepare your body for surgery. Discuss any concerns or questions you have with your doctor, including potential risks, recovery time, and long-term effects. Arrange for transportation to and from the hospital, as you won't be able to drive yourself home after surgery. Prepare your home for recovery by stocking up on essentials, arranging for help with household chores, and creating a comfortable resting space. By following your doctor's instructions and taking these preparatory steps, you can help ensure a successful surgery and a smoother recovery process. Remember, communication is key throughout this journey, so don't hesitate to reach out to your healthcare team with any questions or concerns you may have. Preparing for a hysterectomy involves several essential steps. Your doctor will provide specific instructions based on your health status. You'll undergo a comprehensive medical evaluation. Inform your doctor about all medications and allergies. You may need to adjust or stop certain medications. Quitting smoking is crucial. Maintain a healthy diet and exercise routine. Discuss any concerns with your doctor. Arrange for transportation to and from the hospital. Prepare your home for recovery. Follow your doctor's instructions for a successful surgery and recovery. Section 5. Recovery and aftercare, navigating the healing process. Recovering from a hysterectomy takes time, varying by procedure and individual healing rates. Nurses will monitor your vital signs and pain levels. Pain medication will manage discomfort. Expect some vaginal bleeding and discharge, which should decrease over time. Care for your incision site as advised by your doctor. Gradually increase activity, starting with short walks. Avoid strenuous activities and heavy lifting until cleared by your doctor. Attend follow-up appointments to monitor healing and address concerns. Recovery is gradual. Listen to your body and follow your doctor's instructions. Patience and self-care are crucial for proper healing and regaining strength. Section 6. Life after hysterectomy, embracing the changes. Life after a hysterectomy involves adjusting to both physical and emotional changes. One significant change is the end of menstruation. While this can be liberating for many women, it can also be an emotional adjustment as it signifies the end of their reproductive years. It's important to remember that a hysterectomy does not affect your hormones unless your ovaries were also removed during the procedure. If your ovaries were removed, you may experience surgical menopause, which can cause symptoms such as hot flashes, night sweats, and vaginal dryness. Your doctor can recommend hormone replacement therapy or other treatments to manage these symptoms if needed. Sexually, you may experience some changes in sensation or lubrication, but many women find that their sex lives remain satisfying after a hysterectomy. It's important to communicate openly with your partner about any concerns or changes you experience. By embracing these changes and seeking support when needed, you can navigate this new chapter in your life with confidence and well-being. Section 7. Emotional well-being. Coping with the emotional impact. Undergoing a hysterectomy can have a significant emotional impact, even if it was a necessary decision. It's normal to experience a range of emotions, including relief, sadness, anxiety, or even grief. Acknowledge and allow yourself to feel these emotions without judgment. Talking to a therapist or counselor can provide a safe and supportive space to process your feelings and develop coping mechanisms. Joining support groups or connecting with other women who have undergone hysterectomies can offer a sense of community and understanding. Practice self-care activities that bring you joy and relaxation, such as spending time in nature, engaging in hobbies, or listening to music. Maintain open communication with your loved ones about how you're feeling, allowing them to provide support and understanding. Remember that healing takes time, and it's okay to seek professional help if you're struggling to cope with the emotional impact of your hysterectomy. Your emotional well-being is just as important as your physical recovery, and there are resources available to support you throughout this journey. Section 8. Seeking support, resources, and guidance. Navigating the journey of a hysterectomy can feel overwhelming, but there are numerous resources available to provide support and guidance. Your healthcare team, including your doctor, nurses, and therapists, are valuable sources of information and emotional support. Don't hesitate to ask questions, express concerns, or seek clarification about any aspect of your care. Support groups, both online and in person, offer a platform to connect with other women who have undergone hysterectomies, share experiences, and offer each other encouragement. Organizations such as the American College of Obstetricians and Gynecologists, or ACOG, and the Hysterectomy Association provide reliable information, educational materials, and resources to help you make informed decisions about your health. Remember that you don't have to go through this alone. Reaching out for support, whether from loved ones, healthcare professionals, or support groups, can make a significant difference in your overall well-being throughout this process. Section 9. Making informed decisions. Your health, your choice. When it comes to your health, making informed decisions is paramount. If you're considering a hysterectomy, it's crucial to have open and honest conversations with your doctor about all available options, potential risks and benefits, and long-term implications. Don't hesitate to ask questions, seek clarification, and express any concerns you may have. Gather as much information as you need to feel confident and comfortable with your decision. Remember that you have the right to a second opinion if you feel uncertain or want to explore alternative perspectives. Ultimately, the decision of whether or not to undergo a hysterectomy is a personal one. By weighing the risks and benefits, considering your individual circumstances, and seeking support from trusted sources, you can make the best choice for your health and well-being. Section 10. A second opinion, ensuring the best course of action. Seeking a second opinion is a common and often recommended practice when facing a major medical decision, such as a hysterectomy. It allows you to gain a fresh perspective, confirm your diagnosis, and explore alternative treatment options that may not have been considered initially. A second opinion can provide reassurance if both doctors agree on the best course of action, or it can open up new possibilities you may not have been aware of. When choosing a doctor for a second opinion, look for a specialist with expertise in the specific condition for which you're considering a hysterectomy. Don't hesitate to ask your primary doctor for referrals or consult with other healthcare professionals for recommendations. During your appointment, come prepared with your medical records, test results, and a list of questions or concerns you have. Remember that seeking a second opinion is your right as a patient, and it can empower you to make the most informed decision about your health. Section 11. Living fully. Embracing a healthy future. Undergoing a hysterectomy can mark a significant turning point in a woman's life. While it may bring about changes and adjustments, it also presents an opportunity to embrace a healthy future. By prioritizing self-care, maintaining open communication with loved ones, and seeking support when needed, you can navigate this new chapter with resilience and strength. Focus on nourishing your body with a healthy diet, regular exercise, and adequate sleep. Engage in activities that bring you joy, reduce stress, and promote overall well-being. Remember that your worth and femininity are not defined by your reproductive organs. Embrace the strength and resilience you've gained through this experience and use it as a catalyst for personal growth and self-discovery. Life after a hysterectomy can be fulfilling and meaningful, filled with new possibilities and a renewed sense of purpose.